August 21st, 2011 is a day the residents of Goderich won't soon forget. When an F3 tornado ripped through the town, it uprooted trees and the lives of many. But staying strong through it all were the healthcare professionals who acted fast and provided care when it was needed most. Without knowing the extent of the damage or the number of people requiring help, healthcare professionals had to jump into action. Only minutes after the twister carved a path of destruction through the town, the first patients started showing up at the ER doors of the Alexandra Marine and General Hospital.
People that were affected by debris that had lacerations, and people that were, I'll say, head injuries because of flying debris, and it had pieces of cement or lumber because they were flying lumber and tree branches, and people that had cuts and gashes to their lower bodies. But at that point, there wasn't anything significant.
Outside the hospital, care providers at the CCAC and Maitland Manor began their procedures to make sure clients were safe and accounted for.
And at that point, called our access department to get them to start looking for our emergency level 1 clients, who are clients that need to be contacted within 12 hours of any kind of an event. And so we got that process started, and then called Sandra Coleman, our Chief Executive Officer, to activate our emergency response plan. So then at our Monday morning meeting, our main focus at that point was to make sure staff were safe and to make sure that clients were safe.
I mean, there was tree branches down, but we weren't directly impacted. But walking in, we were on auxiliary power, and a lot of our staff and residents were still not really sure what was happening out there. One of our residents was actually caught outside, but a passerby brought her in from the windstorm, because the wind was so strong.
Fallen trees and power lines made it nearly impossible for staff rushing to get to work. Soon it was realized if staff couldn't get there, who else couldn't get through?
There were people that drove up to a certain point and then actually had to walk in because they couldn't get any further. There were people that I know some people that actually drove up and then got in a car with someone else and drove further, and then got stopped and then drove further.
With the disaster, the police closed down the town from all areas. So even our food delivery service trucks were being pushed back and we're not being allowed to deliver. So my part was to identify from Rick which trucks needed to come through. I would liaison that back to the OPP to say this truck's coming in through this highway, allow them through. They tried to get to the hospital and they would give them okay to come through. So that took a little bit of time, because I think for his first couple of trucks they got pushed away and we ended up with no food. So we ended up with, I think, Salvation Army providing us with meals for one of our meals.
We were communicating with other long-term care homes, not knowing whether we'd be able to accommodate the laundry services. So just even thinking, we had to start planning ahead and just didn't know how long we'd have to plan for, because there was notifications that the Union Gas could be off for up to a week or later that week. So you just had to start putting those plans in motion, changing our menus. We had to change our menus, not having natural gas, even not having hot water in the home. So we had to make sure we were communicating that information to the Ministry of Health as well.
As word spread of what happened, the town and the medical community experienced an outpouring of support.
We have to commend a retired nurse, was one of our first extra set of hands that arrived on site. And she came on site and said, I no longer have a valid college registration. I've been retired for a year, but anything you need me to do, I'm here to help. So Susan and Mary, the nurse that was retired, immediately set up an area for the walking wounded. Having arrived at the hospital at about just shortly after 4 o'clock, almost at the exact same time, the Goderich helicopter landed right across the hospital. We didn't request for the helicopter to arrive and for that support to be here. It was here within a half an hour, as we say, of the tornado.
Events like these reinforce the power of integration and the importance of health service providers working together to better serve patients and the community.
On the Monday morning, we received a call pretty much first thing from one of our community partners asking if we'd consider taking a crisis admission, which was that individual was alternatively placed in another home. But then we received a call from the hospital that they were preparing themselves for a disaster. They were trying to clear off a floor, and so the hospital had requested that we admit one of their patients into the home who was on our waiting list. So we were able to coordinate that and have that resident admitted that day. Then by Tuesday we had another lady that was in the community that needed to be placed as well. Her family lost their home, and so CCAC was in touch with us and asked us to admit her on a crisis situation for a short time.
That I think the other partners were the other hospitals actually across Ontario. And even out to British Columbia and Scotland, calling us and inquiring as to our safety and our well-being and could they do anything. And so a number of the CEOs called me, and board members were calling, and so it was, I think as Cheryl had said, it wasn't just a community thing. This became a wider, and the hospitals were so good in accommodating us with any transfers that we needed to do, because we wanted to really minimize having patients sort of at ground zero here in the communities. So I just wanted to also mention that within our LHIN and outside of our LHIN, we had tremendous support and offers of assistance.
Felt like everybody really pulled together. Even other long-term care homes were calling to make sure we were okay, because we do have an emergency response plan that they would possibly take some of our residents to their site, so they were following up as well.
The disaster also served as a reminder of the caring, compassionate, and dedicated people working in healthcare in Huron County.
Well, we had one staff specifically that had just worked a 12-hour night shift the night before, and she lives outside of town, north of town. They actually drove to the outskirts of town, couldn't get through because all the roads were closed. They parked their car outside of town, and she walked all the way through town to come to work and help. So that just shows you what the commitment and the concern that she had for the residents that live at Maitland Manor.
You know, many of the staff in Goderich were personally affected through this storm, and their dedication and caring for the clients to make sure that the clients were safe, and working with our hospital partners and our service provider partners is just, you can't describe it. It was just so amazing.
You know, we didn't know their story, but as an example, one of the first responders that was in was an employee who lives, well, we have two employees that live on West Street, that is one of the main streets affected, but one of the employees in particular lost her home, her car, all her possessions. She escaped with the clothes on her back. She didn't even have her wallet, but yet she came into work. And that speaks amazing to the ability to respond, you know, and put the community as a whole as a first rather than themselves. You know, this person had lost everything, but yet still came into work.
To find out after being here for 5 or 6 hours, you know, to hear do you think it's all right if I went home? Because when I left, my roof was gone. My children start school next week, and I have to figure out what we have. And I thought, oh my God. And, you know, and that speaks volumes, and it was like, oh, what are you want to say, why did you come? But you know why they did, because that's obviously why you're there too.